It's another day with the physicians where your health is our business.
With growth spot the end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that not only when your pressure is high that you have glaucoma.
Sugar, and I don't know about any other one, but what you know is
You're welcome back to the Training Culture of your regular program.
We have ways of monitoring what we do. We have ways of correcting ourselves and say, oh, these things we used to do 50 years ago, they no longer work. We need to try something else. We need to gather more evidence. We need to gather more information. We need to gather more data. There is clearly no competition between the two.
Oral tumors appear as a growth or sore in the mouth that does not go away. Oral cancer includes cancers of the lips, the tongue, cheeks, floor of the mouth, hard and soft palate, sinuses and pharynx, the throat. It can be life-threatening if not diagnosed and treated early. When it is caught early, oral cancer is much easier for doctors to treat. Yet, most people get a diagnosis when their condition is too advanced to treat effectively. If you see a doctor or dentist regularly and learn how to spot suspicious changes, you'll have a much better shot at an early diagnosis. So why do people not present themselves early? Is it that the face or the mouth is not visible enough? Well, on your regular health TV talk show, The Physicians, we shall be treating oral tumors, squamous cell cancers of the oral region, talking about the causes, the presentations, the diagnosis, management, and of course, possible complications. We'll be back after this short break. Stay tuned. It's another day with the physicians where your health is our business. Today we'll be discussing squamous cell cancers of the oral region, the causes, the presentations, diagnosis, and management. Of course, my name is Dr. Martina Agbere, and with me today as my very wonderful guest, he is Dr. John Wemambu. He's a senior registrar, oral maxillofacial surgery unit at the General Hospital, GBAGADA. Doctor, you are welcome to our program.
Thank you very much.
Nice having you after so many trials.
Yes,
I'm getting you. You've been very busy. Finally, you are here.
Yes.
I'm sure because you are also the Secretary, Nigerian Dental Association of Nigeria Lagos State Branch. You have been so busy, elusive. But at least you have made it to the physicians, and we're glad to have you.
Thank you very much, Dr. Agbere. And it's just a coincidence that the World Oral Health Day is coming up on Sunday. So I just told myself I have to try and be here before that
Well,
day.
you know, the physicians will always target when these important health dates are coming, so that we're able to project it better. So we're talking about these oral tumors, squamous cell cancers of the oral region, the causes, the presentations, the diagnosis, management, and of course possible risk factors. So let's hit the ball rolling. Okay. You want to give us a general overview of the oral region so that we can understand where these tumors will be coming from?
Okay, thank you very much. Now, the orofacial region, as we call it, for those of us in that field, is made up of the face is divided into the upper third, the middle third, and the lower third. So the orofacial region consists of both the middle third and the lower third, and every component in it, which includes the teeth, the muscles, the mucosa, the tongue, down to the pharyngeal region, and even to the floor of the orbit and the bony cavity of the orbit. This all encompasses the area called the orofacial region that oral maxillofacial surgeons deal with.
Wow. So everywhere, anything that has to do with the face, the mouth,
yes.
Really?
Yeah, like we say it in layman terms, the bony component of the face, take away just the brain, the cranial part, but every other part and every component of it. Now, the oral maxillofacial surgery unit or department is intertwined with the ENT surgeons, and we also the ophthalmologists. So we always have this symbiotic relationship, this working relationship with them, because it's an area we all deal with.
So when you talk about the squamous, that word squamous, you know, for our viewers out there, what about the squamous cell cancers? What do you mean? Is it has to do with the upper mouth, the soft muscles? Just explain it better.
Okay, generally, let me start this way, that it's important for us to know that oral cancers generally make up the 6th to the 8th most common cancers worldwide. And now when we talk of oral cancers, we have cancers that are classified based on the tissues from which they arise. Now, basically in the orofacial region, you can have cancers related with the blood and blood support system, which we call the lymphomas. You can have cancers related to the salivary glands, the adenomas. Then you have cancers that arise from connective tissue. Those are the sarcomas. Now, when you also have cancers that arise from the epithelial tissues, and it's under this that we have the squamous cell carcinoma that we're going to talk about today. So it's a cancer, a malignancy that arises from epithelial tissues. It's important to also note that it is not every swelling or every tumor that is cancerous. Tumors can either be benign or they can be malignant. So it is these malignant tumors that we classify or we refer to as cancers, cancerous tumors. The benign tumors could also arise from all these organs and all these areas we've talked about. But talking about the oral squamous cell, the squamous cell carcinomas, those are carcinomas that are malignant because of their ability to spread to other parts of the body and affect other tissues of the body, and they arise primarily from the epithelial tissues.
Okay, so now we're dealing with the squamous cell cancers. What are the causes? Because I know you'll tell me now that causes unknown, idiopathic. So what, yes.
Yes, thank you, Doctor.
Or risk factors, if you want to say
yes,
that.
okay, yeah, I was going to say that as we speak today, there has not been any scientific data or study that can pinpoint exactly that this is the cause of any of these cancers. What we have generally is we have things that we refer to as predisposing or risk factors, those factors that can predispose you to having these cancers, this squamous cell cancer. But it is important to know that most cancers and most tumors arise as a result of genetic mutation of the cells. Now we have these basic cell lines in the body. Once there's a mutation in any of them, it leads to a tumor. Now, when any of these mutations that occurs becomes malignant or has a tendency to spread and then escapes the tumor suppressors in the body, they go haywire and become malignant, and then we come out with the squamous cell carcinoma kind of cancers. So the predisposing factors, basically, alcohol has been known to be a predisposing factor, because alcohol generally acts as a solvent that for most of these carcinogens. Cigarette smoking, and not just cigarette smoking, tobacco chewing. In the southeast region, they have these betel nuts, the betel squid they chew. All these have been known. Then exposure to some form of radiation, even as the sun, exposure to some of these could have also been seen as predisposing factors. Now, remember I said there's no one single area that can say, oh, this is the particular cause of any of these cancers, but so many predisposing factors, and every day you go out there, data and studies are showing more that there are more predisposing factors that could help or that could predispose these people to these cancers.
How common is it in our environment?
Well, a study done 2012 shows that in our environment we have as much as over 1,000 cases of cancers presenting in our hospitals yearly. And out of this, because of the general apathy of our people to health and general apathy, maybe understandable because of the economic situation of the country, to things that matter to them, it has a high mortality, about 780 something mortality rate out of these over 1,000 that present yearly.
That is high too.
Yeah.
That is really, really high.
Yeah, it is high.
Now they present to you as the doctor, the consultant that is there. But then, what are their presentation? What do they usually come with?
Okay. Now, basically, some symptoms we see with these cancers, ulcers. Most of these squamous cell carcinomas start off with ulcers.
When you say ulcer, let them understand, because we think it's the gastric ulcer,
okay.
like a wound.
Okay, yeah. When we say ulcers, we mean there is a breach, there is a defect in the epithelial lining of the body. Now, when there is what we call a wound, in local parlance, you have a wound. In the orofacial region, we have some subsites that we say, oh, these are common sites that you have cancers appearing. The lips, the buccal mucosa, the gums, what we call the gingivae, the posterior end of the lower mandible that we call the retromolar region, the tongue. Most of all these areas are areas that have been found to people present commonly with squamous cell carcinomas with. Now, when you have a wound in any of these areas that is not healing, you begin to suspect. It raises a high index of suspicion. Now, when you have this wound that comes with this bad breath, very bad breath, that should also raise a high index of suspicion. And then for the teeth area, you have teeth that, well, basically maybe your oral hygiene, like we say, is fair, is good, but you have teeth that become very mobile, as in shaking. It should raise a high index of suspicion that there is something definitely going on here that should not be.
Wow. So presentation most times is ulcer.
It comes with
which is
ulcer.
a wound
Yeah.
that is not healing properly, that are not really healing. Then you have bad breath. Then of course probably a tooth that is just free and is mobile.
And sorry, one of that, pain. But most times for these squamous cell carcinomas, they don't usually start off with pain. They start off with a wound or an ulcer that is not healing. But as it progresses, the pain comes. And depending on the site it is, there may even be difficulty, what we call difficulty with mouth opening, trismus. You have some marked trismus. And so when you begin to see this, it raises that suspicion that you should see your oral maxillofacial surgeon.
Wow. But then let us keep a date with the physicians. Let us hear what you have to say about tumors in the mouth, wounds that are not healing in the mouth, bad breath that is probably associated with cancers. What do you know about oral cancers? Let's hear from you on Keeping Up with the Physicians. We'll be back after this short break.
is as a result of an abnormal growth, so to speak, is attributed to cancer, irrespective of where that cancer lies on somebody's body. We could attribute that to an abnormal growth or an abnormal tissue growth, so to speak.
Okay, one of the things I also saw is smoking. When smoking is one of them, consumption of too much alcohol, that one is also part of them. And I think when you don't eat well, I think when you don't eat well as well, you don't like get frequent balanced diet, balanced meals. So yeah, I think those are one of the symptoms.
Cancer is a hereditary form, and you can inherit. It's something that can be inherited from one's parent. You know.
Okay, I think those that are at risk are majorly most men, and the more threats are actually attached to those at the age of 50 and above. So yes, men, yeah, and fewer of women.
Science will always tell us, like the medical doctors, like the medical practitioners will always tell us, early detection is key. When you discover anything that is abnormal in your body, be it your oral, be it any part of your body, when there's any abnormal, anything you can't discern, you don't understand about your body, the best bet is to seek medical attention.
Okay, I would say reduce, if you're smoking, reduce your smoking level, reduce your smoking, and reduce the intake of tobacco as well. I think tobacco is also one of it. And reduce your alcohol, and as well eat more balanced diet. And also go for treatments, go for checkups for your teeth and stuff like that.
Welcome back. If you have just joined us, you're on to your regular program, The Physicians, where your health is our business. We've been discussing oral tumors, squamous cell cancers of the oral region, talking about the causes, the presentations, and we're going to move on to the diagnosis and management. And in the studio with me here, I have Dr. John Wemambu. So, Doctor, you said all this that has to do with the causes, the presentation. So now we have heard all this. How is it managed? In fact, how do you really do the diagnosis of this?
Okay, let's start this way. We've found out that most people that present with any of these symptoms or signs, most of them present late. And going further to question them shows that many of them start with some very purportedly homemade suggested remedies. We've had cases of people coming in, and when you ask them, you find out that they put things like petrol. They have any of these, they put things like petrol in the mouth. You find out that people tell you they blend potash and all sorts and put there, hoping that it will go. And we've even found people that go to some of these unorthodox healers that gives them a concussion that they take, and they will tell you that they spat out and they saw all the germs that is causing this. So we have an issue with people presenting late. It's important to know that cancers, when caught early, are very, very amenable to treatment. But because our people present late, now when they present, how do we detect that this is cancer? It starts with the routine medical training of history taking. You want to find out when and how they started. And most times for cancers, especially squamous cell carcinomas, they have, I said earlier that most of these cancers, a basic denominator between them is cell mutation. When these cells mutate, when they change, when they transform, they go haywire. Now, so you want to find out, because for cancers, they have a very high, rapid rate of transformation and spread. Once they mutate, they keep growing. So you want to find out how long this has been. And so we find out that for these ones, because of the high mutation, high transformation rate, they tell you that, oh, this swelling or this pain or this wound started like 3 months, 4 months ago. Then after taking your comprehensive history, of course, you want to look at, being a trained physician, you have pointers to look out at. Then we are going to send them for investigation. Basically, CT scan or MRI. The basic investigations we start with all the other blood works. Then when we collate all this together, we're able to arrive at a diagnosis to know the type of cancer it is, to know the rate of spread, and to also know the best way to manage it.
Okay, so with this done, how do you now manage the patient, like treatment options?
Now, for treatment options, you first have to stage the cancer. I said earlier, when caught early, it is amenable to treatment. So we need to stage it. For treatment of cancers, there are 3 basic ways you treat them: surgery, radiotherapy, chemotherapy, then the palliative care. So depending on the staging you arrive at, just surgery alone could do it. And that's those ones that fall into stage 1, you know, just starting. Still, there is the classification system we use in classifying them. That would be a bit technical if I go into that. So, but when it is caught early and the rate of spread or the extent of spread is not much, surgery might do it. Depending on how it goes, you might need to add chemotherapy or radiotherapy to surgery for this treatment. And there are some, I said it earlier, like some of these blood-borne cancers, like we call lymphomas. Those ones are just drugs, chemotherapeutic drugs, just for that. But the most important thing is you find anything that is not normal with your orofacial region, you see a doctor as soon as possible.
Are there complications for this one? And the prognosis really depends on presentation, right?
Yes. Now, prognosis always depends on a number of factors. Depends on when the patient is presenting. It depends on what the patient is presenting with, that is the grade of the cancer. Then it also depends on the socio-economic well-being of that particular patient. You find a patient that's the socioeconomic class is a bit on the low side, so you know malnutrition is even a problem without the cancer. Now this would, of course, act as poor. It will act as an adjunct to poor prognosis. Okay. Because for people that have gone through this, people that have cancer, aside the management and the treatment, they need good nutrition to replenish the body cells. So prognosis, if caught early, is very good. If caught in the middle, prognosis is fair, but if caught very, very late, prognosis is poor.
Okay, I know the cancer of the oral tumors is not something that is interesting. Cancers on its own is not even interesting, not talk of an oral tumor. What are the possible complications if one has an oral tumor?
Well, the complications will range with the same complications we have with cancers. Cancers are cancers. The rate of spread, where has it spread to? So you could have complications from those areas where it has spread to. And even the management of cancer, surgery, any form of surgery. Remember, we're talking of the orofacial region. It's the window of the body. You look at somebody, the first thing you are seeing is the face. Somebody says hello, the first thing you are looking at is the teeth and what is in the mouth. Now, every surgery, no matter how small it is, gets something, some part of that tissue, some part of the body away from it. Okay. So there's a high chance of deformity. Okay.
Thank you very much, Dr. John Wemambu. It's been nice having you here, talk so much about the oral tumors and the causes, the risk factors, the presentations, diagnosis, and of course, possible complications and treatment. I'm sure when we call again, you'll be able to respond and we won't come running anymore. At least we've been able to put you on the physicians.
I'm sure we'll do more better now.
I really appreciate. So thank you so much, my dear viewers out there. I'm sure you have benefited from today's topic, which was on oral tumors and squamous cell cancers of the oral region. Oral region, just the mouth, and of course the facial region. We talk about the causes, the presentation, diagnosis, and of course the management. So thank you so much for being part of today's program on the physicians, because we care so much about you, and we want you to always keep a date with us anytime when this program is coming up. Again, remember to follow us on our social media handles, on Facebook, on YouTube, on Instagram, and on Twitter. And if you want to be part of this program, just click away, just send us an email, and you'll be invited to be one of our guests. I remain Dr. Martina Agbere. Stay blessed. Till next time.
Hello everyone, a very good day to you out there. I am Dr. Tolani Oyerinde, a mental health physician, and I'm here on the program The Physicians to discuss self-health care. Make sure you get the right information to engage in self-care. So everyone out there, please keep watching The Physicians. Do not miss any episode. Your one-stop station and shop to get the right health information. Thank you.
The viewers at home, the relatives of the women down there should, as a matter of education, know about this, because it's a global health concern to all.